Hello again. It's nice to see so many of the same faces back after the break. Hope everyone is feeling recharged. The afternoon will continue to deliver some exciting content, and all the content from today will be available to view on demand within 24 to 48 hours. So don't worry if you missed something earlier. So let's explore a topic that's important in the NHS, but has great significance in the wider world too. According to NHS Employers' annual survey for 2020, 44% of worker absences were caused by work-related stress. NHS Digital Statistics for 2020 also support that the most common reasons for absence in the NHS are stress, anxiety, and other mental illnesses, which 500,000 full days lost. So, how are healthcare leaders tackling workforce wellbeing to ensure that wards aren't left understaffed and that staff on site don't experience burnout? Let's explore the future of our workforce wellbeing and how we can best support NHS staff with my expert panel. They are Melanie Maughan, Wellbeing Manager for NHS Business Services Authority, Siven, Rungien, Mental Health Legislation Manager for Southern Health NHS Foundation, and Dr. James Gilleen, Senior Lecturer, School of Psychology at the University of Roehampton. And don't forget the Q&A feature to the right side of your screen is built in so that you can have your voice included in our conversation. So welcome to a full house for our afternoon panel. James, I'd like to kick off with you, if I may. You were the principal investigator of the largest UK study to date assessing the psychological impact of the COVID-19 pandemic on NHS healthcare workers, which was published last year. So I know that sounds like it's probably going to be a weighty document. In a nutshell, can you give us an idea of what the impact has been and what your findings were?
Yeah, sure. First, thank you very much, everyone, for the invite to speak today. If we cast our mind back to around, January, February of the beginning of COVID, we were seeing what everybody was seeing, this huge impact on the, healthcare workers in China, then in Spain, then in Italy. And so with, consultant friends of mine, we thought we need to kind of capture this. We thought it's really important to know what this impact is going to be on the NHS and its healthcare workers. Now, the trouble is, of course, that, and I'm kind of skipping ahead a little bit, we all know from being here, all the people who are attending, that NHS staff are already very stressed, already overworked or close to burnout. So it was very important to make sure that anything we captured was distinct from those existing issues already. So we did a big survey. We looked at how people were before COVID, how things changed after or during COVID, and tried to quantify this with some statistical analyses, which I might say for another day. But the long and short of it really was that healthcare workers were, of course, as we all know, extremely impacted by the COVID pandemic in their mental health and well-being. What we saw in general terms is really a quadrupling of the number of NHS staff who were experiencing very severe levels of anxiety, stress, and depression. And obviously a large number of people experiencing PTSD symptoms. So a really big impact very quickly in people who are already, to some extent, very anxious and stressed already.
As you say, that's easy to forget that obviously people were already stretched to the limit before the pandemic. We'll come back to you in a moment, James, about what we can do to, what learnings we've got from that and how we can protect staff in other situations. But Siven, what steps did your trust take to, engage staff during the pandemic, and how did the steps that you took contribute to the well-being of your teams?
Sure, thank you, and thanks for inviting me to the session today. So one of the things that we did as an organisation, as organisations across the nation did, was we were looking at how we would deploy a COVID risk assessment to be able to speak to individual members of staff about the risk factors that they may hold regarding the COVID infection. But one of the things that we did, and it led to it being seen as an example of good practice in our particular ICB, was that we decided to frame ours as a COVID wellbeing conversation. So we thought that the idea that it would be a risk assessment was a bit too clinical for something that was so sensitive, and picking up the earlier point of staff being so stressed, the last thing that they needed was to go through another risk assessment conversation. So we framed it around a wellbeing conversation, really. So it wasn't just talking to individual members of staff about the risk factors that they held, but also giving them, I guess, the psychological safe space where they could have conversations with either their line manager or someone that they trusted around their overall concerns regarding COVID, whether that was on a personal level and a professional level. So what we tried to do that then was to kind of look at our staff as a whole, and it softened the conversation and allowed more of a dialogue. And the idea around that was, on the one hand, we recognise that we need staff to be on site to keep services running. But in order to do that in the long term and make that sustainable, we needed to make sure that we took care of the individual as well. And that's what made the difference for us.
And did that work well for you?
Yes, it certainly did. We actually had to do a number of iterations of the wellbeing assessment before we got it right. And it was interesting in terms of talking about what staff needed, because there was elements of spending time with line managers to talk to them about the approach of the document, and that it was there to generate a dialogue. And though the form provided a framework and there were some bits that absolutely needed to be completed, it was there to guide the conversation in that spirit of dialogue, as opposed to making it transactional. And as I said, there were a number of iterations that we had to go through before we had the form at the place that we wanted it to be at. But we got there in the end with that piece of work.
Brilliant. Let's bring Tom into the conversation, if we may. How has it been for you, Tom, in South West London and St George's Mental Health Trust?
So my name's Tom. So I'm an exercise therapist working in South West London. I think you just missed me out, Helen, but just at the introduction, just to introduce myself to. Did
I miss you out? Were you not on my introduction? I do apologise. That's the first time that's ever happened on these virtual conferences.
That's okay. So in South West London, so we have also kind of taken some innovative steps that we are running a project around staff health and wellbeing in the service that I'm part of, and I'm very much on the ground floor with that. So we're leading like health and wellbeing events, in making sure that people are aware that what access to kind of health and wellbeing services to our physiotherapists. We're providing group exercise classes. We provide a running club as well. So it's providing people with social opportunities as well. And obviously, as an exercise therapist, I'm going to be slightly biased on the benefits of physical activity for mental well-being and also physical well-being, which we know that they are linked together. We're not two separate beings. We are one person.
Well, we'll dig a bit deeper a bit later on, Tom, about those benefits, which I think are just incredible, the benefits that you get from physical exercise. I think it's definitely helped my family during lockdown as well. So we'll come back to that in a minute. I want to bring Melanie into the conversation so she doesn't feel forgotten there. Melanie, welcome. You lead internal programs designed to improve the well-being of colleagues. Can you would say has been your most successful initiative, and give us a sense of what impact it had?
Yeah, so in terms of, obviously we're quite different in terms of an organisation from kind of the other kind of people on the panel. So we support the NHS, so we're not as frontline as the rest of the guys on the panel. And because of that, a lot of our colleagues have worked from home from the very early days, and we had a huge loss of community, which has been, I would like to say, devastating, because as an organisation, we're quite family orientated. That's always the way that we've been. So that void that was left was having a huge impact on colleague wellbeing, especially kind of the mental health side of it. Now, I don't think it can really be underestimated, the connection, and maybe there is some kind of joy in being together in difficult circumstances, whereas our colleagues have been very much separate from that. So the largest initiative that we've run, we have very strong colleague networks. From our BAME community, we're LGBTQ+, and we've utilised those networks, those social networks, to drive forward initiatives. So we have lots of forums, and we use that to kind of support colleague conversation around things like, difficulties around shielding and that shared experience. And we've certainly done well. We've run a whole programme for about 2 years now. We've tackled some really difficult subjects, like around bereavement, long COVID, that people are really, really struggling with, shielding. And in terms of kind of the the wider response from the organisation, we figured really well in staff surveys around this in terms of the support that we've offered. We've got best not for profit in the best companies, which is, very challenging times, but has really shown that obviously those kind of opportunities have really supported colleagues. And, you can drag through lots of initiatives, but ultimately the most important one is about having community, which obviously we've lost. So that to me has been paramount. Yeah,
absolutely. I mean, James, we're listening there to some great initiatives. What do you think we can do to protect the mental health of staff in the future, should, God forbid, we find ourselves in this situation again? What learnings can we take away?
Yeah, I've got a couple of points to make about this. We, in our study, what we found actually was there's a very strong statistical link between better mental health outcomes and social support. Sharing stress at work, something very simple, sounds really intuitive, and I think that it is that way because it's something which I think kind of has face validity, that sharing your stress is going to be effective at lowering the chance of you having these very severe mental health problems. So that's one thing. The other thing that I think is that there are many, particularly in the last 2 years, many initiatives, NHS hubs, lots of different clinical services and NHS Trust trying to develop initiatives, and they're all very varied, and it's good that people are trying different things. I think the one thing that struck me is from our focus groups is we've got to be a bit aware of the demand that it puts on healthcare workers to be involved in those initiatives. And I mean that in terms of, we were having in the focus groups, I've done 12-hour shifts and then somebody wants me to go and meet with a clinical psychologist, but I want to get in the bath with a glass of white wine after a long shift or whatever. And I think, so we've got to be a bit aware of that. And there was a study in China, a big hospital back in the early times of COVID, and actually they developed a whole hub. They had this wellbeing room for staff, and the staff said, don't give it to us, give it to the patients. We just need a bit more rest between our shifts. That's what we really want. So you've got to know that actually people are going to engage with it when you've done it.
But what are, James, the long-term effects? I mean, are people going to suffer some long-term effects from what they've been through? I'm talking about healthcare workers, and how can we mitigate those?
Yeah, the evidence from SARS and MERS was that PTSD symptoms can be very persistent over the long term. At the moment, we're doing follow-up works of our COVID project to try and track those longitudinal effects, and we'll have that data published hopefully quite soon. But that is definitely the case, and I think if we bear in mind that there's a very strong link between mental health and, as we already said, burnout, being stressed, but also, unfortunately, it impacts on patient care, as naturally it would with any job if you're very stressed and anxious. So I think that it's not only what's happening now, as you say, there are second waves, third waves, new variants, other pandemics in the future. We've got to be very aware of what these accumulative effects are going to be on mental health over time.
Siven, what lessons are being learned from other workforce initiatives that you brought in?
Sure, thank you. So I guess in terms of other lessons that we're learning, one of the things that we can think about is some of the additional things that are happening at the same time as trying to manage the pandemic and its aftermath. So as we all probably know, we have the National 50K Nurse Initiative, and as part of that then we have an international recruitment drive. And so, for example, I believe that we currently have around 4,000 nurses coming through on the international recruitment drive in the Southeast alone. And one of the things that as we're finding as we bring international recruits in is that we are bringing in highly qualified staff from other nursing and caring jurisdictions. And there are some quality aspects that we need to make sure that we're picking up along the way. So as we're bringing new staff into our own caring culture, as it were, then what can we do to make sure that though they're recognizing that they are highly trained, to make sure that their competencies are aligned with the standards that we have here and that they're properly informed. But then it's not also just making sure that they're clinically prepared to enter the workforce and workspace that they're going into, but what holistic and pastoral care can we provide to them so that we can manage some of the stresses that they will experience coming into a new culture, touching upon some of the things that James mentioned about the additional stresses that they face. And so as we're conducting surveys with our current cohort of international recruits, we see lots of learning coming through about some of the things, some of both the small and larger things that we can do to make their settling in a lot easier, to reduce the stress that they're facing, and then to make their coming into the workforce, that transition a lot smoother.
Siven, just briefly, Andrea asks, would reduction of weekly working hours help? I guess that's an obvious answer, I guess, to that.
Is that a question directed to me?
Yeah.
I guess on the one hand, I've looked a little bit into it about, we see that there is a push in a number of sectors, and I guess the question is directed to the 4-day working week. And I guess in other sectors, there is demonstration of the benefits it has to both the staff who are able and the industries who are able to benefit from that and their services. I guess the thing that we have to try and work through as the NHS is that we are unique in the service that we provide, and whether we currently have the current infrastructure to be able to implement that 4-day working week. And I guess that's one of the things that we're looking at as part of the people plan, about having a workforce fit for the 21st century. So I guess it has to be part of that conversation to see if we can build that into our service delivery.
Andrea just follows up actually with saying that the city of Gothenburg in Sweden introduced, she says, a 6-hour working week. I presume that's a 6-hour working day, perhaps, as an 18-month experiment. The results were hugely positive. Employees took less sick leave, reported being in better health, and felt more productive and motivated. Talking about feeling more productive and motivated, Tom, how can being physically active benefit the NHS workforce? I know you lead by example because you lead the running club, don't you? But what benefits does it bring?
I think we all experienced throughout lockdowns, and if we've had to isolate, the impact of being physically inactive upon mental health. I think Melanie touched upon the fact of being socially included as well, and people having to work from home with that. And James mentioned that element of, even if it was just in the bath, that element of self-care as well, which being physically active is a part of looking after yourself. And there's strong evidence that it can reduce mild depression and anxiety, and obviously that would be part of somebody's rehabilitation or treatment, not just the one thing, but it can help to improve concentration, help to relieve stress. And like I've mentioned before, it's not just the mental well-being, but there's obviously a lot of physical benefits as well.
Absolutely. Melanie, now that we are thankfully seemingly coming out of lockdown, what are your biggest concerns that it's left about colleague well-being, and what plans do you have in place to give the support that's clearly going to be needed? Because just because we're coming out of the pandemic, the problems just don't go away overnight, do they?
Yeah, I think, to be honest, if anything, it's just morphed into something else in terms of concerns. So we still have concerns around those colleagues that have been shielding. We have a lot of colleagues with health anxiety, which is kind of preventing them from kind of re-entering back into kind of the world again. So do have a lot of concerns about them. But I think in terms of what's coming through in terms of cost of living, that's a challenge for us. We have a lot of kind of colleagues who, you know, in terms of the banding system around the NHS, are already on the kind of the very cusp of being able to survive. So we've got those challenges around that. So it's nice to kind of think that once the restrictions are over, it's over. But I think it's probably only just going to start to build. And I think that is a concern to us. And I think for us, it's about listening to colleagues, finding out really what's, and always keeping ahead of stuff. I think, you know, the pandemic did catch her a little bit off guard in terms of, we've got this really holistic support available. Took a while to build that. So I think for us, like, the lessons learned is always be horizon scanning, trying to pick up on what people are going to really be triggered by, and making sure that there's an offer there available to them. So as a team, that's what we're really focused on. Yeah,
James, I think Melanie used a key word there. She said listening. When you were doing your research, did you feel that people were quite giving and open when you wanted to hear what their experiences were?
Absolutely. I think, and so many different stories from so many different, levels within the NHS, different roles. The focus groups always over around people who are trying to share their ideas. I think there are many other elements to this. I mean, one thing that I think, just to pick up on a few ideas, of course, we've got the impacts of COVID. We've got the already challenging, roles that people in the NHS have. On top of that, we can easily overlook the fact that they've got the same same issues and challenges that we all have when it comes to lockdown restrictions, plus the chance that they may infect their family, bring virus home. So it's a very stressful position to be in, not least all the other things that we've just mentioned. I think what I'd like to see a bit more of is initiatives to try and identify people at risk earlier. It's better to prevent mental health problems than it is to try and cure them, of course. And I think, one of the things that my study showed is that there are a number of fixed factors that put people at risk of having these very high mental health problems. And those are about the certain roles that you might have. So, of course, being frontline, being young, female, a nurse, these are well established as putting you at higher chance of being at risk of mental health problems. And I think at the moment I'm working with a healthcare app company and a professor of nursing at Essex, and we want to try and develop an app that might try and identify people early who are starting to show severe symptoms, and then maybe we can point them in the direction of services or whatever it might be to try and intercept that before it becomes out of control and they're taking time off work and they're et cetera. That's what I'd like to see more of.
I think at least people feel perhaps a little more comfortable because of all the sterling work that's been done on the mental health front during the pandemic. I feel that people feel more willing to speak up about it, and I think a little bit of the stigma perhaps from doing these events has been removed because so many amazing initiatives have been put into place by people like yourselves. Question for you, Tom, from Emily. Emily says, I work for a Keeping Well hub in North London. We didn't have a huge uptake in the physical activity sessions that we planned. Any advice to help the uptake for after work, lunchtime, etc.?
Well, thanks for the question, Emily. And it sounds like you're doing great work and obviously recognise that physical activity is really important. I would say, again, the key word is that Melanie and James said is listening, to think about maybe why people haven't engaged in it. I think it's how can we make it easy for people to make a change? And I think, as Melanie alluded to, is how can we make it social? How can we include people within that as well?
No, good advice there. I mean, Melanie, you spent, I think I'm correct in saying, more than 10 years as a sustainability practitioner in the NHS and within the private sector. Did that give you a sense of true sustainability, mental wellbeing and physical health, showing how they can all work holistically together?
For me, it's like they're all just intertwined together, very much like the mental health, physical health piece. It's all part of the same thing. We have a really strong environment kind of theme within our organisation as well. And a lot of what we do, we work holistically with them together to talk about kind of the benefits of looking after kind of the environment, what that means. And again, in the pandemic, we all got that appreciation of what kind of natural environment, because we didn't really have a lot else to be able to go for walks and things like that. So the connection is just huge. And for some bizarre reason, it's all just come together in one place at one time. So don't like to talk about blessings with a pandemic because there's been very few, but that appreciation of like our natural space, what that means for our mental and physical health is really, really key, and putting people back in touch with what's really important. That's been a big lesson for us.
Absolutely. Siven, we missed you. I think you had probably some sound issues, so you disappeared on and off. But are there any other workforce matters that you'd like to share with us today?
Without meaning to repeat what I may have missed, so apologies everyone. I guess just adding to what I was just catching on, and the importance of some of the other things that we've done. I guess one of the popular themes at the moment is the concept or the way that we're talking about things, about the intersectionality of our staff. So I guess that theme, and just picking up what Melanie was saying about our different approaches with staff, is really treating them as holistically as we can, and taking a whole person approach to the individual is perhaps one of our key measures and key strategies for helping support our staff with both currently what's happening with COVID and its aftermath.
And you're the BAME Network co-chair for your organisation. So any particular thoughts regarding, equality, diversity and inclusion approaches?
Sure. Well, I guess there's a couple of things. So one is probably thinking about with, as I touched upon earlier, our international recruitment cohort. So thinking if our international recruits are coming from specific heritages, that may make them particularly prevalent or cause them to be particularly prevalent to certain long-term conditions later in the future, then how do you build workforce arrangements around that to reflect what that staffing need may look like in the future to account for that? So, for example, I'm of South Indian heritage. It would appear that those of South Indian heritage are more prone to diabetes. And under certain circumstances, diabetes is a long-term condition that counts as a disability under the Equalities Act. So how do we build our staff services around that is perhaps one thing. The other thing, perhaps in talking to other colleagues and talking about intersectionality, is it appears that we sometimes have our equality and diversity strands on one side, potentially as one piece of work, and inclusion as another, even though it may come under kind of one particular leader within the organisation. And certainly I know, speaking to other partner organisations, for example, with some local authorities in the local region, they absolutely pull them together as strands that link. So equality, diversity and inclusion are all part of the same work, rather than being treated as separate, distinct strands of work.
Yeah, absolutely. James, Alice has just popped a question on the sort of group chat. Alice says, what are some of the quick wins we can engage in to benefit the mental well-being of our frontline workers? I'm conscious saying that quick wins in relation to well-being, but surely there are some things that we can to make our workers feel looked after day to day. Perhaps we can take your thoughts first and then Melanie's thoughts on Alice's question there.
Yeah, I was funnily enough about to mention this. I think I think first I'd fully endorse everything we've been talking about with new initiatives, actively engaging or inviting staff to actively engage with these kinds of initiatives to improve their mental health. I think that's absolutely a given. But I think we need to address first is why NHS staff are in that position in the first place. And I think, we need to look at, from some of my work with COVID, is that there were a number of systemic issues, organizational features at the time when COVID was striking that really had a major impact on mental health. And so just to look at this, I'll answer the question in a moment, but at the time, what we saw is conferring very high risk of poor mental health. There was a lot of things in the organization about lack of preparation, pressure to work without PPE, lack of PPE, lack of training, inadequate communication of things around COVID, et cetera, and that kind of situation made people feel very much at risk, both in terms of their professional duties, but also in terms of obviously risk of getting COVID. So I think, and those, by the way, those what I would put all together as being controllable factors, i.e. we could have controlled them in advance if there'd been an impetus to do so, thereby reducing risk. But I think that would be what I would say, particularly around COVID or pandemics, is that you will prevent the risk by having really good management and organizational preparation so that staff feel they are not at daily risk of threats from virus or other things. So I think that'd be not an easy win now, but certainly during the time of a pandemic, that would be something that should be looked at in future. I think the initiatives that have been talked about by the others are probably the best quick wins. And certainly that's what I probably endorse as well. I think there's not enough evidence at the moment from any of these on a large scale to know really what's most effective. But I'd just make one final comment, which is that just like we'd imagine it's going to be, certain things are going to work for certain individuals. What is it that will make you feel better, make you relaxed? And I think showing people a whole portfolio of things that they can engage in, that they can pick and choose from, is going to be the most successful.
Melanie, thoughts that you want to add there?
I think for me, it's about capitalising on kind of the leadership that you have in your organisation, and it will already be there. Those leaders who are articulate around kind of their emotional response, using them to get that message to flow through, to then help colleagues engage with that. That's what I would say, and that's what we've found within our organisation. So yes, you can have initiatives, you can have programmes that cost money and take a long time to get off the floor, but if you've got people out there who are leaders, who people look up to, who are prepared to share, talk about what their experiences, it just opens the floodgates and it encourages those that really can make the impact on kind of their teams to come forward and access the support that's available. So that's definitely finding out who those key people are and getting them to speak up for you.
And just final thought, Tom, since I missed you off at the introduction, which I'm still not quite sure how. But could our workplaces be designed better to then, encourage a bit more physical activity? Because there's a lot of sitting down done at times, isn't there? I mean, perhaps nurses wouldn't think that. I'm sure they're running around. But how can we make the workplace more suitable to encourage some activity?
I think that's a good point, that it's not just the NHS is not just made up of nurses and doctors that are moving around all of the time, that we do have people that are sat down for long periods of time. So providing people an opportunity to maybe have standing desks, or enabling people to be physically active upon their commute. So I know that a lot of NHS trusts will have bike sheds to store bikes, maybe engaging that, making cycling safer in the community, but also sometimes it's really struggling to find a shower within NHS trusts.
Wow.
As well.
You never think of things like that, do you? But that's so important. Thank you for that final thought. I knew this was going to go fast again. We are out of time yet again. That half an hour just flew by. So I'd like to say thank you to an amazing panel, to Melanie, to Siven, Tom, and James. It's been great to have you on board today. Thank you very much for taking time out of what I know is a busy schedule to be with us. We're going to take another break now. So this is your last chance to get the most out of the event by utilising all the functionalities on the NHE 365 platform. Whether you want to make a connection, share thoughts in the live chat, or get talking with our exhibitors. I'll see you back at 3:10.